webinar which has been organized by Disability and Development Consortium India on poverty, hunger and disability, the missing link. I'm on to the last presenter, and quickly to introduce him, his name is Mr. Ketan Kothari. So Ketan has been actively involved in the disability sector for the last 30 years and shouldered various responsibilities, mainly two leading organizations, National Association for the Blind and Sightsavers India. And during Ketan's tenure in NAB India, one of his key achievements was the setting up of Asia's first ever cyber cafe for the blind in partnership with Microsoft. Ketan has successfully brought about amendment to Indian Copyright Act to enable print disabled access to books, literature, and multimedia. He has also been instrumental in getting suitable policy changes for accessible banking and financial services for visually impaired. He has represented Sightsavers at many UN meetings. In his current role as technical specialist, Ketan is involved in creating enabling environment for people with disabilities and advocating for their rights by analyzing policies and suggesting necessary alterations. Today, he is going to share the findings of a study jointly conducted by Rising Flames and Sightsavers on situation of women with disabilities during COVID-19. And the title was Neglected and Forgotten. Over to you, Ketan.
At the outset, let me thank Venki and Arman for inviting me to this extremely informative webinar. So many new things to know. So coming to the study that we conducted last year, or rather year before last, that was in 2020, we conducted a study on situation of disabled women during COVID time, and this was a time when we had very strict lockdown, the first lockdown that India had, and our findings were glaringly disappointing. In every sphere that we conducted our study in, starting from food security to health, education, to social protection, employment, access, everywhere there were problems. And initially, when we started the study, we were expecting to speak to about 40 odd women, but we ended up speaking to 82 women all across India in 9 self-declared disability and 12 experts, especially on education. And we had to unfortunately decline many of the women who wanted to speak to us due to paucity of time and time that was being spent. Now, the first thing that we found, and that all of the earlier speakers have mentioned, is that absolutely full absence of desegregated data on disability, more so on women with disability. So whatever we found, there was nothing that could, there was no data either in government or even in private sector to validate or otherwise. So we had to go by mere anecdotal evidence. It was very difficult to pinpoint data. Now, coming to issues. Firstly, accessibility became a major concern during the time of COVID, especially the first wave, when everybody was actually in the dark. Nobody knew how to face up to this challenge, including medical practitioners. So our people with disabilities found it extremely difficult, and so much so that especially people who were deaf or hard of hearing did not even know for a substantially long period of time as to why they were being locked up, or they couldn't go out. They only came to know gradually through Ish News, the special channel for deaf, and through some friends that this is what was happening. the area of food security, well, provision of food was a very difficult proposition. Many of the friends from villages faced tremendous problems in terms of accessing food because they were not able to get ration, although it was declared that everybody will get free ration. It became extremely difficult, especially when people with disability were either staying alone or had elderly people with them and nobody to go and fetch a ration for them. The women found it very difficult to negotiate with these kinds of difficulties. And even in urban areas where people used online services to order food, etc., access or lack of accessibility resulted in many people not able to take advantage of these services. And I'm just telling in extremely brief what the findings were. In the area of education, findings were very, very disappointing. Online education was not possible for many people, many of the disabled girls and boys, because they were not having equipment required for education. Also, they were not able to have network. So even if they had phones, firstly, those were not smartphones, and even when they had smartphones, network was a very big issue. And for women and girls, the other issue was the sociological problem, whereby they were given last access to these gadgets after all the able-bodied brothers finished with their education. So their education suffered in multiple ways. In terms of employment, many of the people with disabilities, especially those that were working in lower jobs or middle-level jobs, had to leave their jobs because firstly they couldn't travel, and also social distancing meant that traveling for people who were blind or wheelchair users was becoming difficult because they could not get use of their fellow beings, which was customary practice. So all this resulted in tremendously hard situation for our disabled women friends. In the area of social protection, I need not say more than what has already been said. So the results were extremely glaring. People did not get pension on time, and even when the ex gratia pension was announced under Prime Minister Pradhan Mantri Garib Kalyan Yojana, the 28 women who were eligible, none of them had received this particular ex gratia installment. And in fact, when we spoke to commissioner of a particular state, I cannot name it here, he told us that, well, it was actually what we did is we paid you in advance the pension of coming 3 months, and there was no extra money that was being declared. So if you can imagine the plight of our friends who had to, on one hand, forgo their jobs, and on the other hand, they had to sustain themselves with very limited income. The plight was extremely painful. And so these were our findings in very, very brief. What we also realized that since there was no uniformity in pension, it resulted in a very, very unequal and unequitable distribution of pension. So I personally feel that time has come where we ask for legalization of these pensions, and not only that, connect these pensions with the government declared indices such as the consumer price index or the inflation figures, because then at least we can get some kind of connectivity with the level of price rise or level of expenses that need to be conducted, because otherwise this pension just stays where they are for 15-20 years without any change, with diminishing value, in fact at times minus value. So it is extremely important that now we should start advocating for linking the pension to these indices and also to minimum wages, because many of our friends are getting pensions which is not worth even the paper that we're talking about. So it's a very, very important area where we should all look for. This is my suggestion, and I hope those of us who are here will also percolate this to our friends, so that we, if not now, maybe in 2-3 years time, because this pandemic doesn't seem to be going, and we will be in this situation for a long time to come with adverse results. Thank you, Akhil.
Thank you very much, Ketan Bhai, and for making sure that you give us the glimpse of the study that you conducted, and your suggestions are well taken. Thank you very much for your time.